Namaste, good afternoon to all. We have the panelists joined here, we have attendees here. Right, I think the time is also right. Namaste, David. Shall we start? Go ahead.
Deepesh Bhaiya, can you make me co-host? Because I'm not able to start the studio. I think that right has been removed from.
Who is saying that?
Deepesh Bhaiya, this is Bindu.
Bindu Didi.
Can you make me co-host? Because somehow that right has
No,
been
I
removed.
cannot make it. Actually, UHV 22 Foundation is the host now.
I cannot make it. Actually, UHV 22.
Yeah, now you're co-host. Yeah, shall we start?
Bhaiya, I think people are yet to join. Shrija Didi, Pravina Didi, and Manoj Ji. They are in the backstage.
Yeah,
Pravina Didi, Manoj Ji. They are in the backstage.
Deepesh ji?
Ji, Didi. I'll start. Yeah.
Yes, please.
Namaste. Good afternoon to all. My name is Deepesh, and I'm in the role of Regional Coordinator of Southwestern Region of NCCIP AICT. And right now, I'm talking to you from Kannur in the state of Kerala, in India. And I warmly welcome all our esteemed panelists and all the delegates who have joined from various locations around the world to the day one of panel discussion on holistic human health. I also welcome all the participants who have joined by live streaming via YouTube channel, and also our support team members and volunteers to this session. So you two participants can also put the questions and comments, and we would try to take some of them as soon as possible. So now, the moderator for this session is Sri Manoj Jalani ji. Sri Manoj Jalani ji is currently the Director, UHC Health Systems, WHO, Southeastern Asia region. He has over 30 years of experience in public policy and socio-economic development with a focus on health. He has served as Joint Secretary, Additional Secretary, and Special Secretary, Ministry of Health and Family Welfare in India from 2012 to 2019, including as a Mission Director of the National Health Mission, the world's largest public health program. And he's also a recipient of several awards, including the UN Interagency Task Force Award for contributions to addressing the non-communicable disease challenge in India. So with this short introduction, let me warmly welcome Sri Manoj Jalani ji for the moderation part. Over to you, sir.
Thank you, Mr. Deepesh, and good afternoon to everyone, to all the panelists and all the virtual attendees. Welcome to this virtual panel discussion on day one in the special interest group on holistic human health, which is one of the three special interest groups under the overarching theme of holistic value-based education for a humane society. So on day one, we discussed the need for holistic human health. And I think on day two, we'll discuss the vision for holistic human health. And on day three, we'll discuss implementing the vision for holistic human health. I must compliment the organizers for gathering a galaxy of eminent panelists, which have been working in the area of humanizing healthcare, if not necessarily in the area of holistic healthcare, but these two are related. Now I have pleasure in introducing our eminent panelists. I'll begin with Dr. Saroj Jaisinghe. Dr. Saroj is Emeritus Professor of Medicine and a specialist in internal medicine from Colombo, Sri Lanka. He has had a pivotal role in reforming the curriculum at the Faculty of Medicine, introducing behavioral sciences into medical education and promoting a more holistic MBBS program. In 2018, Professor Jaisinghe organized the first international conference on medical humanities in Sri Lanka, and I recall with WHO, we had organized another conference on medical humanities in Colombo, Sri Lanka, and he coordinates the global network on health humanities. Our Dr. Saroj, if you could just wave, yeah, thanks. And let me now introduce Dr. Raj Lakshmi Iyer. She graduated from the Grant Medical College, Mumbai, specialized in rehabilitation medicine from Madras Medical College, Chennai, and was at All India Institute of Medical Sciences, Rishikesh, where she set up the MD program and also started and headed the Department of Medical Humanities. Presently on a sabbatical from work to care for her parents. So Dr. Raj Lakshmi, if you could just, yeah, thank you. We have Dr. Thanini Sahakitrungrong. Apologies if I'm getting the pronunciations wrong. It's always difficult to get Thai names correctly, but usually they also have pat names. Unfortunately, I don't know the pat name of Dr. Thanini, but please forgive me if I pronounced you wrongly. He's a professor of pediatrics at Chulalongkorn University, Bangkok, Thailand. She trained in pediatrics and pediatric endocrinology at Chulalongkorn University and completed a 2-year fellowship at the University of California, San Francisco. Currently, she is the Assistant Dean for Graduate Affairs and a member of the Steering Committee for the School of Global Health at Chulalongkorn University, where she is responsible for developing the global health curriculum. She plays an active role in the development and implementation of humanistic medicine and education in Thailand. Dr. Thanini, can we, is she there? Not able to necessarily see her, probably. Then we have Dr. Nitin Nagarkar. He completed his MBBS with honors from Patna Medical College Hospital, his Master MS in ENT from PGMER Chandigarh, an expert in ENT head and neck surgery with a focus on oncosurgery. He was the founder director of AIIMS Raipur for almost 11 years and also held an additional charge of director AIIMS Bhopal. Very nice to connect with you, Professor Nagarkar. We have known you since my ministry days. Is Dr. Nagarkar, I don't know, maybe my screen, I need to.
Sir, they are joined combinedly from SRM. You can see them in one video.
Okay.
Yeah.
Okay, now I'll have to change my view part here. Anyway, Dr. Sharmila, she's the source for designing this session. And Dr. Sharmila Asthana did her MBBS from Indore and MD in pediatrics from the Regional Children's Hospital of Southern NJ, USA, New Jersey, USA. After working at St. Christopher's Hospital for Children in Philadelphia, USA for a few years, she moved back to India, where she set up the pediatric department and was the senior consultant pediatrician with Apollo Hospitals for about 2 decades. In 2018,
It's not showing.
all right. In 2018, can we others please mute their mics? In 2018, she left the medical practice to devote her full time to universal human values and pursuing a holistic approach to health. She is a volunteer resource person for many of the universal health values and HHS programs of All India Council for Technical Education. Dr. Sharmila Asthana, please.
Namaste, everyone.
Yeah, thank you. We'll hear your thoughts and initial presentation from you. Then we have Dr. Mrinalini. She did her MBBS from Tanjavur Medical College, Tamil Nadu, and MD Anesthesiology from Stanley Medical College, Chennai, Tamil Nadu. She's a certified pain management physician from National Health Education, England, and currently working as Associate Professor of Anesthesiology in SRM Medical College, Hospital Research Center of SRM in Tamil Nadu. So with those introductions, let me just quickly share. Mrinalini, Dr. Mrinalini, could you just wave? Yeah,
Yes.
okay, namaste. Yeah, thank you so much. Now let me quickly share the run of the show. So I'll, first we'll request our esteemed panelist, Dr. Sharmila, to place the universal health values point of view on holistic health in about 5 to 7 minutes. And then this will be followed by moderated discussions in 2 to 3 rounds, where I'll be posing questions to each of the panelists and expect them to respond in about 3 minutes. And after that, we'll have some time for questions from our virtual audience, and we'll request them to also indicate as to who the question is addressed to. So with that, may I now request Dr. Sharmila to please give us a presentation, a crisp presentation on the universal health values point of view on holistic health. Over to you, Dr. Sharmila.
Thank you, Jalani ji. Namaste and warm welcome to everyone. Let me just quickly share my slide from here. The slide should be visible on the screen.
You did these slides in specific.
Yes. Okay, so this morning we had a keynote talk on our basic human aspiration. And I think if we look at health, we all aspire to be healthy. So before we jump into the need for holistic health, let's look at health and what we understand by health. So if we look at the definition that WHO gave way back in 1948, it mentioned that the state of complete physical, mental, and social well-being is what would be health, and not merely the absence of disease. Going back even further, if we look at our traditional wisdom from Ayurveda, it says that it is a state of complete physical, mental, and spiritual well-being. So looking at these definitions, one wonders whether we are really addressing health adequately. Are we looking at the physical, the mental, and the social or spiritual well-being or not? So if we look at the achievements that we have made in health, there have been many achievements in terms of reducing the communicable or infectious diseases drastically. I mean, COVID, there was an upsurge, but it was brought into control quickly. Antibiotics, if we see, have revolutionized medical care. Many lives are being saved today because of antibiotics. Vaccinations have led to eradication of diseases like smallpox, and we're close to the eradication of polio. Trauma care has advanced. We have state-of-the-art techniques, surgeries, procedures, again, that are saving many lives. But having said all that, there are also many concerns. So one big concern from this is the non-communicable diseases. I don't think I have to take too many statistics. We are all familiar with the statistics that in India itself, about 5.8 million people die from NCDs every year. It's a very sobering statistic that 1 in 4 Indians has a risk of dying from an NCD before they reach the age of 70. And so on. I'll not spend more time in talking about the statistics. If we look at mental health, in 2019, an estimated 280 million people, or 5% of adults worldwide, had depression. And I think You might agree that this is perhaps only the tip of the iceberg. There may be many more who have been undiagnosed yet. Suicide was the fourth leading cause of death among the youth in their prime, 15 to 29-year-olds globally. And more than 77% are also in low and middle income countries. So these are very, very sobering numbers. And with this, the mental health also has an impact on physical health. There has been a high association between stress and disease. This is what our studies have found. Medical research estimates as much as 75 to 90% of illness and disease is stress related, whether it be high blood pressure, cardiovascular disease, heart disease, or even other issues like ulcers, allergies, asthma, migraines. So the question that comes up is, are we treating mental health also adequately? Or is there perhaps something we are missing here? What would we think about the root cause of stress? Are we clear about that? Because if we don't know the root cause, how are we going to fix it? This is just another one of those statistics. Again, I'll not go more into this. So essentially, there are concerns. One major concern is regarding the health of the people. Like we mentioned, alarming rise in non-communicable diseases, also happening at younger ages, stress and mental health issues, and the impact of this mental health on the physical health. If we look at our concerns regarding our health education and healthcare systems for a moment, we also need to question whether our focus is shifting from being healthy to getting rid of disease, and whether we really want to do that. If we look at even the diseases part, are we curing diseases, or have we sort of succumbed to just managing the disease with lifelong medication through what is being termed, ironically, as a medical and pharmaceutical industry? In terms of the mental health, are we addressing mental health adequately, or are we largely managing it by giving medication, which goes to the body? So are we addressing mind and body is the question, or are we largely focusing on the body alone? Beyond this, when we look, there are other major fundamental concerns regarding values and ethics. As healthcare professionals, are we service-oriented, compassionate to the needs of the sick, or has our system deteriorated to a fee-for-service transaction with the focus largely on profit maximization? Further, do we see ourselves as isolated entities, or are we a part of a larger whole? Do we see an interconnectedness of ourselves with nature? And perhaps is the lack of concern for nature also adding to the disease burden? Like today we have GMOs, we have pesticides, we have cancers relating to what we have, the damage that we have done to the soil and the water and so on. So if this is so, is it not our responsibility to educate our medical students about this? There is also further concern regarding the sustainability of the healthcare system. Is it becoming overly expensive and out of reach for many to have healthcare? Is there fear in the common man about health and the escalating costs of trying to maintain it? So the stark question that comes up is the healthcare system sustainable at all in the current form that it is going? And if you see, despite all the time, resources, the billions of dollars, the effort spent on health, why is this happening? Is there something we are missing? What are we teaching our students? Is there a need to question our medical education system itself? more importantly and fundamentally, is it time to question the very perspective of health that we are giving in education? So one approach could be a problem-centric or a disease-centric approach, which deals with symptoms, as in, for diabetes, reducing blood sugar, high blood pressure, reducing the blood pressure, arthritis, reducing pain and inflammation, and the list goes on and on. Another approach could be a health-centric one, which is dealing with the root cause. And would that be more desirable? So all of these issues, the diabetes, the hypertension, the arthritis, could we think of curing these illnesses by looking at the root cause? Further, could we look at health rather than disease? So on the left side, what we see, the reducing the blood sugar, the blood pressure, and so on, isn't it more like suppressing the indicator, which is not the important part? Correcting the disharmony in the body is. So why are we not able to find this underlying root cause? Maybe it is time for a holistic perspective on health. So with that thought, I would leave you. Tomorrow we can look at the vision, but for now, I'll hand the mic over back to Jalani ji. Thank you.
Thank you, Dr. Sharmila, and for raising some very, very fundamental questions on our health system, on our medical education, on the way we approach health. So now we'll move on to the questions to our panelists. But before I really come to specific questions, let me quickly seek reflections from each of our panelists on the presentation. So I'll start in the same order, in the order in which we had the introductions. So just seek a quick reflection, about 2-3 minutes on the presentation. So beginning with Dr. Saroj. So over to you, Dr. Saroj.
Thank you very much for that very interesting presentation and thought-provoking ideas. It's an interesting way of looking at health, and a relatively novel way, if I may say so, for us biomedical people, because we are used to searching on a more reductionist mode. But I agree that our reductionist approach, which we practice, especially in this so-called modern medicine, has its drawbacks, because we seem to be looking at magic bullets, and we are searching for molecular answers to problems which are wider than molecules. I think the traditional and our own region has such a rich diversity of concepts related to health, of being connected to nature, connected to society, and so on, which we lose by this reductionist mode. So I think it's time for this sort of reflections have been happening before, but I think it's again something which from this region we can bring in and use the vast knowledge which is relatively untapped on newer ways of conceptualizing health, newer ways of conceptualizing the mind, and newer ways of looking at the importance of self in health, and so on. So that's my initial brief comment here. Thank you.
Thank you so very much, Dr. Saroj, for those insightful comments. And also, so besides new way of conceptualizing, I like your talk about health, linking health to nature and society, and it's very important. Yeah, now I'll pose the same, seek reflections from Dr. Rajlakshmi Iyer, please. Over to you, Dr. Rajlakshmi.
Hi. Is it me, or does everybody hear two tracks of the audio with a lapse, time lapse? Does everybody hear two tracks of the?
Yes,
I think
ma'am.
that,
That's it.
yeah,
I can hear two tracks, audio tracks with a time lapse. Is it me?
I think we need to switch off, except Dr. Rajlakshmi. If everyone switches off their mics, we should be okay.
Let's try. Yeah, so I think the need to relook medical education is the elephant in the room. I think everyone
Dr.
agrees that.
Rajlakshmi, are you connected by two things? I mean, your mobile and laptop or something? On your room?
Sorry, would you repeat?
Are you connected with two devices in your room?
Two devices? No, I don't think so. I could switch off my mobile if that helps, but
Let's see.
yeah, are you hearing two time tracks, two audio tracks?
Yeah, we are hearing two times, and I don't know why. With
Oh,
Dr.
right.
Saroj, we were only hearing one.
No, we are hearing two.
Okay,
As
I
of
think
now,
I'll
we are
just switch
hearing
off
two.
my mobile and see if that helps. Oh, it's become three tracks now, I think. Is that better?
I'm actually speaking from your mic itself, I think, because no other mics are actually on. So as Jalani ji was mentioning, any other device, or you said something which is there, that's what I was thinking. You can continue now.
Yes, Dr. Rajlakshmi, please continue. We don't hear you at all.
You are muted. No.
No, we are not hearing Madam at all. She has to.
Your mic is also not seen, Rashmi ma'am. So
Yeah.
probably you can quickly log out and log in, if that's possible. Might be a technical problem, actually.
Then what I suggest is that we move on to Dr. Tanini, and Dr. Rajlakshmi, if you could just get disconnected and join again, probably, I mean, maybe things will get sorted out, but you're muted as of now. So may I now request Dr. Tanini to give this quick initial reflections. Is Dr. Tanini connected? I think probably not. In which case, I'll move to then Dr. Nitin Nagarkar. Dr. Nagarkar, over to you for quick reflections on the presentation. No, we don't hear you. You have to unmute yourself. Yeah.
Am I audible, sir, now?
Yeah, very much. Thank you so much, Dr. Nagarkar. Yeah.
So thank you, sir. Thank you very much, and really pleasure, joining you after such a long time, spending so many years with you. And after my stint in AIIMS, now I'm at the SRM Medical College as the Dean and Pro Vice Chancellor in charge. And we had a wonderful talk just now by Sharmila Madam, and she has very rightly touched upon some very pertinent issues. We always talk about health when we talk in a medical college. We teach our students is we of course start about the disease itself. So we always talk about as a patient-centric approach, and it's the curative aspect which is what is taught to them initially. But I think with the changing curricula that we have, so many subjects, not just the community medicine that is in the past what was referred to as the preventive and social medicine. So many topics are actually now covering the preventive and promotive health aspects as well. But actually that needs to be drilled down much, much more. And I think this point is very valid that we're not just talking about curative medicine. Of course, that is very important. Patients seek treatment in the hospitals, but at the same time, what we can do to reduce the burden of the disease in the first place by understanding the entire concept of health and wellness and not just disease treatment alone. So I think that's one very important concept for which all of us have to work together. It will certainly have a huge economic impact also by reducing the burden of disease and by improving the quality of life and not just the lifespan. So I think, yeah, great opening remarks, sir. Thank you very much, sir.
Thank you so very much, Dr. Nagarkar, and touching on importance of health and wellness over sick care, and also the criticality of sustainability of health financing. You know, the richest country in the world, United States, spends 18% of their GDP, and yet they are not able to ensure universal health coverage. So which is totally unsustainable. If the richest country with the highest GDP is spending 18% can't afford to provide universal health coverage, there is something seriously wrong with this approach. Okay, now let's move on to then Dr. Mrinalini. Over to you.
Good afternoon, everyone. Good afternoon, sir. So even I have been into this UHV journey for the past 2 years. So I have been exploring so many of these proposals. And one of the main reason why I appreciate this holistic approach to health is the importance it gives to the mental aspects of the person and the impact it has on the physical health, and also the social aspect, which pretty much covers the WHO definition of health. Whereas in our current practice in our modern medicine, the focus is more on the physical health, and we are doing a wonderful job in curbing all the diseases with so many advancements. And there is a little bit focus on mental health, but the mind and body connection, where the impact of mental health on the physical health is totally missed out today. And the impact of social well-being on the individual's physical health, that is also totally missing from our current education. So this has made me explore more of this universal human values and holistic approach to human health. So thank you.
Thank you so much, madam, and for touching on the interconnectedness of mental, physical, and social health. Can we now try to reach out to Dr. Rajalakshmi? Is she now available? Yes, over to you, Dr. Rajalakshmi. No, I think you're muted. We don't hear you, Dr. Rajalakshmi. No, you're not audible. Earlier we could hear you 2 times. No, we don't even hear you once. I think hearing you 2 times is preferable to not hearing you at all.
I'm sure using a headphone or something, you can remove, try that.
Maybe your volume settings, maybe if you could check the. we really deprived of valuable insights from Dr. Iyer.
Phone, Didi.
I'm sorry.
Log off completely from the laptop and join us through the mobile.
I think she tried that, maybe. Join from mobile. Okay, maybe. So if Dr. Iyer doesn't mind, we'll proceed with the panel questions to the panelists, and hopefully maybe if you come with the mobile and we'll be able to hear you. Okay, thank you so much, Dr. Iyer. Okay, so let's now come to some specific questions. And I was Dr. Saroj has been really working on the medical humanities point for quite some time. And one of the challenges, I mean, which really was in a way touched by Dr. Sharmila, was around lack of empathy and compassion for the sick and infirm, and lack of ethics. You hear so often about irrational and unnecessary care. And if I bring in my personal experience here, I mean, permit me, I would hope Chatham rules apply here, but a lot of times when I was posted in the Ministry of Health, even very well-to-do people would just call me up and seek a second opinion from AIIMS, saying that we can't trust the private hospitals, whether the treatment being prescribed is really warranted or not. Can you please confirm from an AIIMS professor whether indeed I need this surgery, whether indeed I need a bypass, whether I mean, so the only input, the concern was that they weren't sure about the ethics part of the doctors. And we find in India, Dr. Saroj, just to give you, I mean, it's not true for Sri Lanka, but in India, we had a study on why people are not approaching medical public health facilities, even when there is much less out-of-pocket spending. And one big reason was rude behavior on the part of providers. Okay, that's a big concern. So, I mean, you have been working, and we are looking at ways. I mean, our goal, I think everyone around the table has the same goal, okay? Improving the health and well-being of everyone. And the healthcare providers need to provide in a very humane, I mean, they must be clinically sound, but also compassionate and humane. So your thoughts on how far our current education system and curriculum addresses this, and maybe even how we could probably address the problem. Over to you, Dr. Saroj.
Thank you very much. I think in the region, we have a range of causes of this lack of losing empathy, the reasons for losing empathy and compassion. If we look at it from the type of graduates we get, from the type of entrance we have, I think that also plays a role, because increasingly some of our countries, the closer to the university entrance, you start studying very technical subjects. So you give up on humanities, you give up on any of the art subjects, you stop your sports, and you're just narrow gauge to get through these exams. It's something which we can't help, maybe because there's so much competition, and social mobility depends so much on education. So, but that's one important factor. We are getting people who are being trained to be technocrats and technically minded, and who are losing part of their humanities education. Then once they come into the university also, we have this biomedical model which predominates. And that again, I think is something which we should work on, which we should change. And that's an area as medical educationists, we have some control. And we've been using various, I mean, there are in the literature, there are various ways of of ensuring that people preserve their humanness, preserve their empathy and compassion. And one area which we are using to a great extent is the arts and humanities. And there's a lot of literature now that when we use the arts and humanities in our curricula, you see, it's not extracurricular, hidden curriculum, informal. No, that's not what it means. You must have it inside the curriculum. You give due respect to it. And various ways of doing it. I mean, very briefly, for example, using literature to appreciating literature, getting students to read on literature, and then having discussions around those. Then storytelling, which is, I mean, I know India is very strong on that, and storytelling gives so much of, points of view of others can be highlighted. Then the arts appreciation, visits to museums, there are visual learning strategies which can be used. Then using drama. Music, yeah. Oh, that's part of humanities. Yeah. So, okay. So, see, bringing in the drama, and again, there are these various forms of drama which can be used. I can't remember the word where you become a spectator. You get people to take on roles within a drama. Then cinema being used as education. It's a very good medium because you can critique, you can use cinema and even music and poetry those have an effect on the emotions, and have the capacity to cause transformative learning experiences. So I think there are lots of a whole range of methods, and we did a situation analysis in the region, and there's a wide range of methods being used. So I think that's one way we have to seriously think of, to introduce the arts and humanities to our medical education. Yeah, thank you.
Yeah, thank you, Dr. Saroj, and very interesting way of pointing out the way we select our undergraduates and the biomedical model of teaching, and then trying to introduce humanities in the curriculum itself to try to bring in some degree of humanity within our graduate healthcare providers. And I think the UHV tries to do something similar, excepting they are doing it in the technical colleges here, in the engineering colleges. They have introduced the curriculum on human values in higher education, and that's another approach to try to bring humanity through the curriculum into our students. Will be the future. Now we move on to, I don't know if Dr. Rajlakshmi is there, and I must also request the audience that they can pose their questions in the chat, and we'll try to take them up, after 2 rounds of questions. So now, is Dr. Rajlakshmi available now?
Am I audible?
Yes.
Thank God.
Yeah, great, wonderful.
Yeah, lovely. Yeah, so I wanted to say that the need for holistic education in medicine is the elephant in the room. I think we all know that it's needed. It's just that people either refuse to accept it, or they are reluctant because it's a change. So that it is needed, there's no doubt. I think what we need to focus on is how to get our toe into the door, and then we can slowly get the camel in. So my own experience of medical humanities at AIIMS Rishikesh has been that it's extremely well received by students. And I see medical humanities as a space, as a safe space in the medical college, where students are free to express themselves. So it's not just a personal ventilation for the students, but I think it also pays into making them better clinicians. We started with the students because they don't have a choice and they have to listen. But we also extended it to postgraduate residents and faculty. And we did find that as the seniority grew, the resistance grew also. And the most resistance was at the management level. So questions like, where will you fit it in? Will you make it, examinable? How do we give marks? That sort of thing. So I think there is no doubt that it is extremely useful, both for the medical student, the resident, and faculty. Personally, and I also think it is very useful to improve clinical skills. For example, we had one session where we had faculty, about 10 of us, observe a painting. So we put up a high definition version of a painting, and each of us observed it for small periods of time. And we came up with some things like diagnoses and, so many pallor, anemia, possible diagnoses. And at the end of it, we were all so happy. So this is faculty. So fossiled, cynical faculty, and we so enjoyed it. So that there is a place for it is without doubt. I think that the challenge is how to get it in, where to fit it in, and how to present it, possibly. And here I think the IITs might help, because I think IITs have departments of humanities, and engineering colleges have them. So I think that would be a big help if they would help us translate it to get departments into medical colleges as well. Thank you.
Thank you so much, Dr. Rajlakshmi. And I think it's the need for holistic health and medical humanities, as you pointed out, is well received. And the critical thing is about how to get a foot in the door. Maybe on day 3, when we talk about the how part of it, the implementation part of it, I think there'll be opportunity to discuss in terms of how do you really get it into the National Medical Commission in the curriculum. And of course, there'll be issues around assessments and all, because all our systems are designed that ultimately you want to measure performance and you want to try to make it objective so that you can assess candidates on those parameters. Anyway, let's move on. And if I may touch on, I'll take on Dr. Nagarkar. And this issue, in fact, I would like to, I think Dr. Mrinalini touched upon issue around mental health. And if I may ask whether we should be looking at mental states before they reach a crisis or a disease state. What are your thoughts in terms of, when you have a serious mental state and then we try to provide treatment or management of that condition, but should we be looking at the state prior to reaching what we may call a disease state of mental ailment? Over to you, Dr. Mrinalini, and then I come to Dr. Nagarkar.
So, good evening once again, sir. So when I mentioned the impact of mental health on physical health, like I would quote from my own example, like when 15 years back when I was a postgraduate student, so I used to have so many pain in my body, like neck pain, low backache pain, constantly troubling me, and I had developed plantar fasciitis. So I was taking pain medicines for all of these things, and nothing seemed to work out. And then I noticed something when I took leave, like 2 or 3 days from my institution, all the pain used to get subsided. And again, after I joined work, again, after 2 days, I'll start developing all these pains. So, and then I was thinking, why is this happening? I was just observing the connection between my work and all this pain which is happening in my body. And when I started going through the literatures, I found so much of information about inflammations, cortisol, connection about stress with the physical body, how these inflammatory products can affect all our physiochemical mechanisms in the body producing all these strains. And I can say I even developed autoimmune thyroiditis because of this stress called Hashimoto's thyroiditis. So all linked back to stress. So even from my life, very own life, I can say that mental health is very much definitely having a great impact on physical health. So this is one reason why I'm so much for this need for a holistic human health. Thank you, sir.
Thank you so much, Dr. Mrinalini, and bringing in your own personal experience there. Now, can I move to Dr. Nagarkar? And I just would like to know, the NCDs, and there I would like to know, are we really curing those diseases, or are largely managing them with medication lifelong in an attempt to avoid complications? So over to you, Dr. Nagarkar.
Yes, sir. I think we've been discussing about the double whammy that our country, or developing countries face. On the one hand, we definitely still have infectious diseases, whether it's respiratory or diarrheal, or different types of infections. Even tuberculosis is still common. Of course, we have to a great extent been able to control many of the infectious diseases, but they still play a big role. The COVID, of course, Madam Dr. Sharmila is rightly touched. But now we are also facing in that double whammy the non-communicable diseases, the lifestyle disorders. As the lifespan of most of the developing countries also continues to increase, we come across these non-communicable diseases, whether it's cancers, some types of lung diseases, diabetes, hypertension, musculoskeletal disorders. Many of them are, of course, preventable, but some of them may not be preventable. Yes, they might have a genetic basis, but so many of them are. For example, we all know that a healthy lifestyle will help us to keep our blood pressure under control. Proper physical activity itself, we see that so much of screen time has increased even for the children or the young adults, or even all of us now who are workers working in their offices at long hours. We know that the kind of sedentary lifestyle that we lead leads to definitely, whether it's truncal obesity, diabetes, hypertension. Many of these things are preventable. And if not preventable, at least it will not be to that extent where it becomes so much debilitating for those patients. In COVID, we also came across a very unique situation where those patients who had non-communicable diseases, for example, uncontrolled diabetes or some cardiac or lung condition, their prognosis was poorer, and their even mortality and morbidity rates were higher, definitely. So there is an interplay when it comes to these diseases. And many of the diseases, if not totally preventable, definitely we can reduce the symptoms and reduce the burden, so that, as I have been talking about, the lifespan, if it increases, that's not the only concern. We want a lifespan, but a healthy with greater quality of life. And definitely that is the clue for it, that we have to focus on the non-communicable diseases. Only then we can have a longer lifespan with better quality of life. Sir.
Thank you so much, Dr. Nagarkar, in terms of focusing on the healthy life expectancy, in terms of having not only we live long, but live healthy. And we are importance of preventive and promotive aspects, not only in terms of improving health, but also from reducing our financial burden. Now, can I move to Dr. Rajalakshmi and seek her views in terms of, so Dr. Rajalakshmi, do you think the focus of our medical education seems to be more on disease management rather than on health? And if so, should the health education be given to medical students also focus on how to stay healthy in addition to disease management and treatment? Over to Dr. Rajalakshmi.
Undoubtedly. I think we need to move, but the problem with that is that it seems very unglamorous to medical students. That's been my experience. So cardiology is so much more glamorous than palliative care or rehabilitation medicine. I think all the doctors here will agree. I think we need to glamorize health a little bit. And the other thing I've noticed, it's been my experience, is that the medical students are very resistant to alternative medical systems like Ayurveda or homeopathy, Ayurveda especially. So at AIIMS Rishikesh, we had an Ayush run by the government of India. And we wanted lectures by the Ayush physicians for medical students. And the medical students actually came up and, protested. So they didn't want the lectures. So I think there is this resistance. I don't know. It's probably fed by the media and by the left liberalists that, allopathy is the thing to go to. So I think that is another battle we have to fight. There is evidence-based, efficiency and a place for the alternative systems of medicine in India, especially in rural India. So I think that's one important area to overcome resistance in medical students. And I think we need to start early, perhaps from the induction phase, if we were to include occasionally in the year. And these alternative systems place a lot of emphasis on prevention. So I think that might drive home the point that prevention is also important in healthcare. And I think there should be a place in our minds, however small, for the alternative systems. We must keep open minds and see if we are convinced ourselves. So these are two areas I think, we need to tackle in medical education right now.
Thank you so much, Dr. Rajlakshmi. And I appreciate, besides the issue around lack of glamour, this issue around being open to alternate systems of medicine. We should certainly question, but at least should be open to listening. And in fact, my experience in the Ministry of Health was also similar in a way. And this was rather different from the engineering side, where people would be far more prepared and ready to question than on the medical side, where they would just say that this is what is provided in our textbook. And at times when you would try to seek basic questions, they would basically take recourse to this is what is really provided in our textbook, rather than providing a more reasonable, rational answer, looking into, this is something really I used to find it. I don't know why that is the case, but this indeed was true, that they were far less receptive to newer ideas than on the engineering side, where I had much greater exposure to prior to being in the Ministry of Health and in the WHO. I see Dr. Saroj's hand. Yeah, so let me also tell the panelists here, please feel free to come in. It's more like a discussion. Wherever you think you can contribute more, please feel free to come in and contribute. So I'll take on Dr. Saroj, but I was also seeing some poll here, and a very large part of audience here feels that the current medical education system can largely meet our needs, but certainly cannot address our needs in full. So over to you, Dr. Saroj.
Yes, thank you very much. I'm taking on your point that the medical practitioners are less likely to look at other systems and other forms of knowledge. I think it's part of our colonial legacy, because what has happened in this region is that Western colonization, and along with it came Western medicine, and along with it has evolved to so-called modern medicine. And so as a result, we have learned some of the bad habits which were there during our colonial period, and we look down on indigenous knowledge. We look down on indigenous forms of practice. I mean, you see, they will now. A stark example is how they will look down on some of the rituals of the indigenous culture, but to go in a procession wearing all the regalia of the professional college. So I mean, you see, you're prepared to do that, but you're not, and you look down. That the problem I find is not, if you don't agree, it's okay. Not wanting to follow a certain tradition, it's okay. But you can't look down on things. And I think that's what has happened, because we think we are it. We think we have complete control over knowledge, and our knowledge is correct. We need not bother about other forms of knowledge. I think we should there are two stages. The ideal would be where we begin to respect other forms of knowledge. Now that's happening in the climate change arena, because people are realizing that some of the indigenous practitioners really have solutions to climate issues, climate-related issues, as well as sustainable ways of living. That's one area. So you can have that sort of respect. But at least we must realize that the patients who come to us have different points of view. And even if we don't personally agree with that view, we have to respect their view, because that's our, I don't like to use the term client or customer, but that's our group of people we are helping. So I think we should at least aim for that, and certainly more respect. And here again, exposure to these different systems where students begin to realize that there are other systems, and these are being, the people do use those, and there could be benefits, there could be disadvantages, but you have disadvantages and side effects even from our own so-called Western practice. So I think there's a long way to go, but we can make some improvement. Thank you.
No, thank you very much, Dr. Saroj, in terms of probably providing some rationale, maybe colonial legacy, and but very important that we need to respect indigenous knowledge and practices and have an open mind rather than turning a closed mind. And so I would now like to pose a question to Dr. Nagarkar also. He has been in the helm of the premier, All India Institute of Medical Sciences. And one concern I was talking, which Dr. Saroj had also responded, was around the issue around lack of empathy and compassion, and irrational, unnecessary care on some people call it commission kind of a thing, where a percentage of commission is transferred to the diagnostics lab or radiological provider because of those linkages. So what are your thoughts in terms of how do you ensure more that our graduates and postgraduates really carry empathy and compassion and ethics? Over to you, Dr. Nagarkar.
Thank you, sir, for touching upon something which is so very important, especially when we are training our next generation of doctors who are going to care for the public in the future. If you talk about attitude, ethics, empathy, compassion, these are actually the very bedrock of the medical profession. And you rightly touched upon the fact that universal human values are being taught even in the technical institutions. And we are fortunate that we have, through our academic council, got the UHV classes started for the medical college as well. And that is apart from the National Medical Commission curricula. That is, so this is something in add-on. It's an additional thing apart from what has actually to be taught when it comes to attitude, ethics, communication skills, and the standard core subjects. So I think this is one thing which we always need to teach our students. So just touching upon my career, which is now spans the medical career for more than 4 decades, we have seen that initially we were on a pedestal, demigods, and gradually saw the erosion of those values, erosion of the kind of respect that the doctors had for them. So something happened, something changed. The society has evolved, society has changed. I worked in the UK and worked in some other countries. There, they don't treat you as demigods, but as professionals. But those professionals who are supposed to do their duty in a proper manner. Not that, there won't be black sheep there. That happens everywhere. But there's something happening in our country because of which the respect has certainly got eroded. Patients expect that when we talk to them, deal with them, that empathy, compassion is there. They want us to spend more time. And sir, I think Dr. Sarosh talked about storytelling, that kind of thing, those humanities aspect. You have to listen to the patient. You have to talk to the patient. You have to talk to the relatives of the patient. I agree that there's a lot of rush. We all have, hundreds and thousands of patients in our OPDs. We take pride that it's a very busy OPD or a very busy clinic, but then we need to spend more time with the patients. And the patient should have the realization, the relatives should have the realization that whenever we are doing the treatment, it is in the best interest of the patient. And that's, I think, one of the reasons, because this bond couldn't be formed. It's both ways, not just, I will not blame the medical professionals alone, but the kind of, if they have that faith, that trust, and doctors have to take, go that extra mile to develop that trust, then continuously seeking that second opinion, which Jhalani sir has just referred to, possibly would not happen. And then, many times we get those kind of patients who have shown 3-4 places, and again, they want a 5th opinion. Then I have to tell the patient, don't worry. You see, these doctors have told you which is something which is correct, and please have faith in us. Continue the treatment in one place, wherever you are satisfied with. But then it will save your time, it will save your money, and your condition for which you are seeking treatment will be, you can seek that treatment better. So many things we do explain to them. And our traditional systems of medicine also place a lot of importance in one-to-one interaction with the patient. And in those traditional, pearls of wisdom, we shouldn't forget. But at the same time, it's an evolving society. If the society changes, their demands change, we should be accepting those changes. If we are not demigods anymore, no problem with that. But the trust and faith should not get eroded. That is something which should be there forever. And always listen to the patient. That warmth that the patient wants from you, machines will help us in better diagnosis, better treatments, whether it's a PET scan machine or a robotic surgery equipment. But the doctor's touch just does not go away. The nurse sitting with the patient 24/7, a doctor available all the time, that just cannot be replaced. That's the traditional thing. And even if society changes, that trust and faith and the warmth of the medical profession is always desirable. Sir.
Thank you so very much, Dr. Nagarkar, in terms of criticality and importance of trust. Just to give you two important statistics. So amongst the various professionals, the most trusted professional globally is the doctors. So that's a good thing. I mean, for those around the table, many of you would be doctors. That globally, I don't really know the Indian statistics, but globally, the most trusted professional is a doctor. So that's good. The other thing I was reading was that in terms of with AI and AI replacing a lot of jobs, one area of jobs that are not likely to be replaced is the health and care workers. So again, your future is bright. The only thing is that what Dr. Nagarkar pointed out is the decline. And the reason why they were demigods was they were few, but they were respected because they also brought in huge amount of human values. And I don't know, probably because of privatization, a lot of private colleges coming up, people paying capitation fee and all that, and then trying to recover those investments. I think a lot of places we somehow got our overall health systems wrong, and now we have a situation where the trust part is really on the decline, where you're not confident that whether the treatment that's being prescribed is indeed warranted or not. But I think we need to really introspect and look at ways in terms of how do we try to retrieve and really enhance the trust between the patient and doctor, which is critical for success of our treatments. I would then now like to open the floor for our audience. We have about 15-20 minutes left. And I would like to ask our organizers in terms of how do we take the
Sir,
question.
sir, excuse me,
Yeah.
sir. I'm
Yes, yes.
Nalini. Can I just add on something regarding
Yeah,
this
please.
topic on lack of compassion and thing?
Please
Yeah,
feel free. Please feel
then-
free.
yeah.
Sure.
From this, I've been exploring this UHV essay, and we have been speaking about how doctors, the status of doctors have come down through decades. So I would say it is not that doctors are intentionally not showing compassion or there's a lack of compassion. I'd say that doctors are also human beings who are there without clarity on what is their purpose in life. So, for after my self observations and explorations, I would say I wanted to become a doctor, but even after becoming a doctor, I could not find that satisfaction or happiness which is there, because I always placed my source of happiness on patients, how patients see me, how patients speak to me, how other doctors treated me based on how many patients I have waiting to see me, how patients are requesting personally to see me. So these were all my sources of happiness. So when I placed my happiness on the outside, there was this discontentment because I could not get satisfied at all the time. When something favorable happened to me, I found that satisfaction and happiness. And when things did not happen like I wanted it to happen, I had the discontentment and unhappiness. So when I operate from this state of unhappiness, I could see I easily get irritated, not only with my patients, with my colleagues, with my family, with everyone around me. So I would say one of the root cause for lack, so I don't say lack, supposedly lack of compassion, is because we doctors are human beings who are operating without clarity on where to place our source of happiness. So now doctors are graded on how many hospitals they are visiting, how many surgeries they are operating, how many patients they are seeing. So I would say this focus on outside is one of the root causes for the supposedly lack of compassion. So when we shift our focus from outside to inside, so what I really want to do with my life, when I keep my focus on that, then I wouldn't be bothered about all the outside events or out people, how they comment on me or how they speak to me. So I am going to remain in harmony. So this harmony and happiness is easily spread to everyone. Like I would just quote your example. You have such a beautiful smiling face. Just by looking at your face, we feel that happiness spreading into this forum. So that is what is required. You can see doctors in OP who are all so much with tension and frustration and irritation. And that is getting spread to people. It is not the intention of the doctor to spend less time with the patients or to speak in a rude voice to the patient. It is just the disharmony and the frustration which is inside, which is getting shown out without the intentional doing of the doctor. So I would say if every individual as a human being, let alone doctors, focus on keeping their happiness inside, harmony, knowing the purpose in life, then I would say it is going to spread out naturally. And this supposedly lack of compassion, I think that topic is going to go away. So it is not only the doctors, it's every individual who needs to work on our own happiness.
Wonderful.
Thank you, sir.
Thank you so very much, and thanks for the kind words. But important thing you mentioned was around having clarity on purpose of life, and more importantly, about having the locus of happiness within you. I mean, once people realize that locus of happiness can be within us, then we are safe that outside other people or circumstances don't determine our happiness, because our locus of happiness is within us. And if that understanding becomes more pervasive, maybe we'll have more, we'll automatically have more compassionate human beings. So that's one approach to generate more humane and compassionate healthcare providers and overall, I mean, general citizens. So now we'll take some questions. So do you think your thoughts and emotions have an impact on your physical health? Strongly agree, 84%. So 84% people believe that thoughts and emotions have an impact on our physical health. And strongly agree and 13% agree. So basically, practically everyone agrees or strongly agrees. I don't know whether we have an opportunity for people to raise, I mean, how do they ask questions? They are to put it on the chat. I'm just trying to look on the chat. Are there questions there? Alternate and complementary medicines, the need of the hour, need more thought on this. Yes, Dr. Iyer, madam, alternate complementary medicines, the need of the hour, need more thought. Ayurveda took a lot of time than usual, allopathy, yes. And then you have
Dipesh is there? Maybe Dipesh might be able to.
Yeah, Dipesh, over to you.
Yeah, there was a question like even after a huge achievement by students, high-ranking officers, professionals, etc., more deaths are occurring. Government also doing a lot of maintaining mental health. Is our family teachings and academic system teachings needs more elaboration on spiritual perspective? That was one question there by Devendra Kumar.
And who do you want to address it to?
I mean, that was in the text form, actually. So probably if...
Should we ask Dr. Rajlakshmi?
I think for spirituality, sorry, you were saying?
Please go ahead. No, please go ahead, yeah.
Okay, I think for spirituality to take root, one needs certain life experiences. And I think if we are thinking of medical students, they are really young. They are in their 20s. And I think if you say spirituality, they're going to be very resistant to it. So we need to sort of sugarcoat it and present it in palatable ways, I think, to them. But I think as we go along the journey, I think we all finally come to realize that, you know, there's something more, and we all naturally veer to spirituality. But for medical students and medical education and the really young people, I think very, very much needed. But we need to sort of quote it properly or deliver it in a proper way for them to accept it. These are my thoughts.
Thank you, Dr. Rajlakshmi. Dr. Saroj, would you like to reflect?
On the idea of introducing spirituality, yes, I think we'll have to be clear what we mean by spirituality. If it is development of the self and virtues and so on, I think it's going to be more acceptable. But when we say that, I'm all for introducing the sort of beliefs and practices and heritage of this region. I think it's important that we resonate with some of the ideas. Unknowingly, we are otherwise propagating or locked into a certain type of thinking. This is especially seen in the culture of individualism versus collectivism. So I think Western medicine or current modern medicine is really pushing practitioners towards this individualistic pole of thinking and of the self, rather than being an interdependent in the interdependent pole. In fact, tomorrow I'm doing a oration and I'm touching on this. I'll probably share the link, the Zoom link with you. Thank you.
Thank you very much. Very important and interesting to look at the current biomedical system.
Is there Dr. Devendra Kumar, faculty? He's unmute. Namaste, Dr. Devendra Kumar ji. Did you get your answer? Sir, did you get your answer?
Good afternoon. Actually, this is Devendra. I'm talking from Oman, basically living in India only. Actually, what we are looking now in our family and teachers teaching and family teaching, there is a huge gap. Spirituality is going too beyond rather than just action of satisfaction. This type of things are not. When we listen or see in the news that people are dying, even they are highly achieving persons and even they are dying. Uh, Diseases are secondary. We are not talking about disease. Even they are healthy, but they are getting dying. Why in this direction our science education or modern medical education, are they doing something or they are simply addressing the critical issues? I'm talking especially about the allopathic medicine, allopathic treatment system. They are challenging or addressing only the critical situation, or are they trying to follow up on some value-based base input of this spirituality, something like in their core system? Is there any scope? This is actually my question.
Janani ji, could I respond to this?
Yes, please.
This
Sorry,
is Sharmila.
no, my apologies, Dr. Sharmila. I forgot you were also a panelist, so my apologies, sincere apologies. I thought you were
That's
just
okay.
you were the one to introduce. So sorry for that. Please
No,
go ahead
no,
now.
that's fine. I think what is important is, that we see these two things as separate, religion and spirituality. So when we are talking spirituality, I think our focus should be on how things actually are, what the reality that exists. If we can find that truth, if we can search for that truth or see what that is in some form, we'll find that it is universal. So where spirituality unites in terms of being similar, religion tends to divide. And so that the two need to be separated. And I think one of the lessons that we have learned from the experiments that were done with the AICT and the engineering students is that when you put these, profound sort of fundamental truths in a manner in which it can be received by students, it has a profound effect on the students and they are more than willing to receive it. In fact, we have seen, we have a morning session, in terms of bed, like we just call it the morning session. But in fact, those who have gone through UHV workshops, they have the choice of attending these sessions where we are trying to fundamentally look within in the form of exercises, 2 exercises. And many of those faculties that have attended this have found remarkable changes in the way they approach life, their stress levels, their physical conditions. And some of those people shared today, and there will be others perhaps who will share tomorrow. But I think that raises the hope that this can be one way or one approach where we put things universally, so it unifies and people are actually able to relate to it, because there is this fundamental need in all of us. And so perhaps we'll talk more about it tomorrow when we talk about the vision for holistic health.
No, thanks. Thank you, Sharmila ji. There's a question there, and I'll ask you. An approach to healthcare talks about whole person, mind, spirit, and body into consideration. Why can't we include yoga therapy and music therapy as part of the value-added curriculum in medical education to enable a wholesome education system to serve the purpose? Over to you, Dr. Sharmila. Shall I repeat the question, please?
Yeah, you're saying why we can't.
So I'll repeat the question. So this is from Professor Dr. A. N. Uma. It says an approach to healthcare talks about whole person, mind, spirit, and body into consideration. His question is, why can't we include yoga therapy and music therapy as part of a value-added curriculum in medical education to enable a wholesome education system to serve the purpose?
Yes. So when we were talking about the reality, this we'll talk more in detail about this tomorrow. But are we really, as a human being, just the body, or are we a combination of a unit of consciousness and the material unit, which is the body? So if we look at it in that format, I mean, what is the way things are, then we should address the whole thing, not just the body or not just the mind, or so more clarity on that would be required for getting to know this fundamental truth. And certainly if we can bring that about in education, which is one of the things that is being done right now with the human values courses, you can see that better health is a very natural outcome of this. Better mental health, better physical health. This is what has been observed. So certainly we would want to do this eventually in medical education also.
I think we are now just about to run out of time. So I must take this opportunity to thank all our esteemed panelists and request all the audience to give them a round of applause, please. And with that, we have had a very good discussion around the holistic health, around body, mind, society, being interconnected, seen together, and then having a clarity around consciousness and body, and trying to then look at a human being in that framework and trying to see that we are addressing their needs comprehensively. So with that, we like to close our day one of our panel discussion, and we'll have another 2 rounds, day 2 and day 3 tomorrow and day after. Day 2 will be focused on the vision, and then day 3 would be in terms of the implementation of vision. Once again, thanks all the panelists and the audience for joining in for this very important session. Thank you.
Thank you. You'll have to excuse me tomorrow. I won't be there, Dr. Manoj. I'm very sorry, but I have
No, I can understand. Thank you, Dr. Saroj, for joining in today. Thank you very much. Grateful.
Right.
Thank you, everyone.
Good night.
Namaste.
Thank you, everyone.
Okay.
Yeah.
Thank you so much. Namaste. Thank
Yeah.
you.
Thank you.
Thank you. Thank you so much. So heartfelt thanks to all our esteemed panelists for a very fruitful session, and Sri Manoj Jalani ji, who was kind enough to be in the role of moderator for the session. Thank you, sir. Thank you to all the delegates and support team members also who have joined, and all the participants who have joined via the YouTube live streaming also. Going forward, you can spend some quality time in the networking and the panelists or the delegates in the plenary room, or see the exhibitions of our partner institutions for the next 1 hour till 4:30 p.m. So let us contemplate on the discussions we had today as part of the keynote and the panel discussions what we had right now. So if we are able to see the need for the holistic health, let's join back tomorrow to the discussion about the vision for fulfilling this gap. And looking forward to meet you all in the tomorrow's session at 8 a.m. tomorrow with the keynote lecture on education for harmony in relationship from family to world family, and panel discussion at 2:30 p.m. So you can view the details of all the sessions from the session tab in the Zoom window. More details can be seen in the website uhv.org.in. You can also visit our YouTube channel titled Universal Human Values. So thank you so much for all participants who have joined, and all who have joined from around the world. Thank you. Namaste. Namaste too.
Thank you.
Deepesh, I can exit, end the call for everyone, right?
G, we can move to backstage, I think, otherwise it will be. Yes, we can exit.
Okay, okay.